Hi, okay, I'm going to talk a little bit about attachment theory. It's a pretty popular topic, but hopefully I'll be able to add one or two points that maybe are a little bit of a new angle for people. So in general, when we talk about attachment theory, what we're talking about is how people manage feeling threatened. Threatened means unsafe in some way, distressed, scared, sick, in need of some sort of help. So, normally when we feel a sense of threat and we're infants or very young, our natural instinct is to seek out a parent or a caregiver to help us. And usually we do that by signaling in some way. We start crying or fussing or reaching out our hands, doing something to try to elicit help or show that we're in some kind of distress. And that's a natural instinctive response when there's some sort of feeling of fear or hunger or some kind of inner need that we don't know how to meet ourselves. In contrast to the attachment instinct, which is to seek help from a caregiver when we're feeling unsafe in some way or some sort of threat, is the exploratory system. And the exploratory system is when we're feeling safe and regulated, we orient outside of ourselves and we learn about the world around us. We are interested in things, alert, engaged, maybe playing or exploring the environment. We're sort of able to orient outside of ourselves because we're feeling safe inside and we don't need to focus on regulating something internal that's bothering us. So in a healthy situation, when parents are responsive to their child's cues and they try to take care of them when they're feeling distressed and make them feel better and comfort them. But at the same time, the parents don't overreact um, or act like helicopter parents or get very emotional themselves when their child needs help and also are not rejecting or dismissive, right? Kind of like brushing away the child's cries or ignoring them or leaving them to fend for themselves or giving the child the message that they should get over it or cope on their own, then the natural thing is for someone to have a secure attachment response where they signal for help when they're in a sense, feeling some sort of sense of neediness or danger or vulnerability, fear, pain. And this extends even into adulthood, right? That secure adults will turn to their partner, to an attachment figure, some sort of authority figure, or someone that they feel safe with, and they'll lean on them for comfort or for some kind of help or help regulating their emotions. And in this healthy situation, once the threat has passed and the person feels comforted, they're able also to like take in the comfort or take in the help from the other person without pushing it away. And then the person is able to move on and be independent and focus again on a feeling of safety and being engaged in the world, right? Doing their job, their day-to-day activities. They're no longer focused on trying to manage some kind of inner threat. The problem is, or the trouble is when the system doesn't work exactly as planned. And then sometimes what happens is a person either learns to suppress their feelings of need or their cries or their show of needing help from other people, and they don't seek out other people for help when they're feeling threatened in some way. Or they may get more and more worked up or escalated when they're feeling distressed, and reaching out to other people could almost like increase that feeling of being even more worked up or make them feel extra clingy or needy or dependent, and it's hard for them to do anything to kind of regulate themselves in those moments. So what ends up happening is we have this sort of system where people who are secure, who are responded to in ways that are compassionate, caring, comforting, but not overreactive, are able to look for help when they feel a sense of neediness. And they're not ashamed of that, and they're not embarrassed, and they know that talking about their feelings or sharing what they're feeling with other people is actually going to help them feel better, not worse. And they're able to look for that help when they need it. Like if something's troubling them, they're having anxiety about something or trouble parenting, they'll just go to therapy. It's not a problem. If they think their child needs medication for some sort of mental health issue, they're not all uptight about it. Yeah, maybe they'll worry about the side effects. They might try something else first, but if their child needs it, their child needs it. They don't kind of overthink it or think there's something really bad about that or worry about pathologizing their child. They just kind of like get the help that the child needs, and they do the same thing for themselves. and they're not afraid to talk about their feelings, and they don't get super dysregulated when they talk about their feelings. They're able to talk about their feelings in a way that is expressive and shows the feelings they're having, but they're not sort of hijacked by them. And by the same token, these are people that are able to also take care of themselves. They're able to use the resources they have, and if other people are not available, they can sort of cope with that. They can manage. They don't feel super abandoned. They don't feel like they have to just like wait and wait and wait for someone to respond to them until they could sort of try to regulate themselves. They'll try to find some way of helping themselves feel better, and then they move on. Once they feel better and their need is met and the danger or threat has passed, they're able to move on. They're able to go back to, being creative, being open, doing their daily tasks, doing things that are practical. So they're in a very flexible kind of mindset. They're able to lean on people when they need help, but also be independent when others are not available or when they don't actually need help. So there's a very flexible balance, and they're able to have the same response to their children or their spouse or other people in their life as well. They're able to provide support when the other person feels vulnerable without overreacting to the other person's feelings and without getting super uptight about it, but they're also not dismissive or rejecting or brushing away the other person's feelings. They're able to kind of be there for them. When people learn that they should either suppress their vulnerable feelings, they should not be needy, they should be in control of their emotions, they should be very practical and solution oriented, right? Like, how do I fix the problem if they're feeling some sort of distress? People that are conditioned to be very independent, otherwise maybe they're kind of shamed a little bit or rejected, or they see their family or their parents treating any feeling of neediness or vulnerability like something that should be controlled or suppressed or is rejected. Then people learn to down regulate their expressions of neediness. They don't show those emotions outwardly. They don't ask for help, and they don't really see the point so much of talking about their feelings with other people as a way of getting comfort and self-regulating through relationship. These are people that really have a more dismissive or avoidant attachment style, and they don't talk a lot about their feelings. They don't search for others to make them feel better. They really focus on practical ways that they could regulate themselves. They like self-help books. They like tools. They like techniques. They want to know what to do about their feelings. And these are people that when they come to therapy are very nervous about getting too dependent on the therapist, usually. That's often a concern they have. They don't always see the benefit or the point of talking about things unless there's something practical you could do to change the problem. So just talking for the sake of talking to another person and feeling better through that relationship and that attachment doesn't really, it's kind of like a foreign idea to them, right? It's like what's the point of that, right? In their mind, there's really no point unless it's a practical thing. And they get worried about labeling themselves or their child, about being pathologized, about making things sound worse than they are, or using a word that sounds too intense, like trauma or anxiety or something like that. They don't like to take medication generally as a pattern, right? Taking in something from outside themselves to make themselves feel better could feel like a crutch, or taking the easy way out, or something that they'll get dependent on and they don't want to be dependent on anything. So that's more of like the avoidant dismissive response to dealing with distress or something that they need help with or makes them feel vulnerable, is trying to feel a sense of control, being very practical about it, and making sure not to pathologize and to focus on coping. On the other hand, people that are responded to in ways that where, let's say, they're upset or they're looking for help and their parents overreact to their emotions or have their own emotion, the parent has their own emotional reaction to the child's need for help or something like that. Or if parents are sometimes rejecting and sometimes they're responsive or empathic about the child's vulnerable emotions, or if the parent is dysregulated emotionally themselves, then what happens is they learn a pattern of getting more worked up as they talk about things, because the person they're talking to in their early experiences is actually escalating their emotions, right? Because the child either gets distracted and focused on their parents' emotions, right? Which is alarming to them and confusing because they're having their own feelings at the same time. Or they end up just getting worked up with the parent, together with the parent, right? So the activation actually increases, and those children are they have a hard time regulating themselves, and they're also a little hard to regulate in relationship because they feel like the other person sometimes makes them feel worse, isn't calming for them. So people with more of an anxious, ambivalent, or preoccupied style can get kind of a real preoccupation with their emotions, very worked up with them, and can also be kind of clingy or looking for a quick fix or a pill or someone else to do something to make them feel better from outside themselves, which is a need they didn't really have met in the past, right? That could be something they're hoping for or looking for. But when we ask them to try to do things to help themselves, things that are concrete or solution oriented, a lot of times they have a very negative reaction to that. Like they just want to be listened to or cared about or made to feel better in some way. So that's kind of the opposite experience. And when those clients come to therapy, a lot of times they're worried about, are you going to be there for me in between session, right? If I get dysregulated. What if we talk about something that's upsetting to me? Am I going to have a way to reach you, or how am I going to cope with that? Right? They're worried about getting more dysregulated as they engage in relationship, and they want relationship, but they're also afraid sometimes, right? They're afraid to trust you, or they're afraid you'll hurt them, or you won't be available. And sometimes when we ask those clients to kind of be a little more proactive about managing their feelings on their own, they experience that as abandonment, or they experience that as re-traumatizing. So that's kind of like the opposite set of anxieties about therapy. A lot of times those are clients that want a medication, they want a pill, they want something to make them feel better from outside themselves, which is not necessarily on a bad thing or unhelpful, but it could also stop them from learning ways to regulate themselves, especially when something outside themselves is not available or isn't working 100% to make them feel better. So these are just some things to think about when it comes to you or your children, your partner, and the idea of needing help, getting help, taking medication, having a diagnosis or a label for things, using words that maybe feel intense or too dramatic, right? People with a more dismissive style or avoidant style tend to minimize their emotional experiences. They downplay how much things are affecting them, how hurt they might be. They may not even be aware sometimes of how much things are affecting them because they don't really pay attention to it that much. And they need to learn how to become a little bit more aware of what they're feeling and to actually be a little bit more sometimes dramatic about acknowledging to themselves how much they've been through or what they're experiencing that's been difficult for them or is a challenge for them, how that's affecting them without becoming threatened or alarmed by that experience of getting more in touch with what they're feeling, even if it feels kind of like a little scary to think about at first. People with a more anxious, ambivalent, or preoccupied style have to get a little better at like taking some responsibility to learn to regulate themselves through skills or inner work or holding on to what the therapy is doing during the rest of the week, trying to internalize and take in some of what the other person is trying to give them without feeling hurt or abandoned when someone's not able to sort of like magically make them feel better. And for all of us, it's good to learn a balance between focusing outwards on the external environment, on doing things that are fun and playful and that teach us new things and expand us as people, versus turning inwards and also focusing on what's going on inside of us and how we can kind of work with that and sit with it and not have to run away from it. And that flexible ability to move back and forth between an inner focus and outer focus, being emotion driven and in touch with our inner world, and also being able to distract ourselves sometimes or engage with what's around us is a really good way to um, help the next generation develop a healthier attachment, right? If we have children, to kind of pass on healthier attachment patterns for them. And it's good for our relationships, and it's good for ourself and our emotion regulation also to try to find that balance. Okay, I hope this was helpful and insightful. And if you have any questions, feel free to post in the comments and I'll try to answer.